This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. One of the discussions that we went to, I think it was maybe evolution of nursing. But there was one that was talking, it was rethinking the team nursing model. And I don't know actually I think this was an early one. We might have been somewhere else, but they were talking about bringing back some of the old ways of nursing in order to combat nursing shortages, like LPN programs. Like why aren't we looking to bringing back this avenue of nursing that could help decrease RN workload? LPNs, I'm not actually speaking facts maybe, but I think that they have faster schooling. It's more accessible schooling. So like casting kind of a wider net of people to like bring them into the workforce. Like, why are we, I think that we have kind of trickled LPNs out, but like bring them back in. Like maybe that would, help some of our, decrease our workload, help with our staffing ratios.
Yeah. And then they also,
So
they spoke to having people and professionals, LPNs and RNs, working to I don't know how they phrased it, but like the highest point in their license, like working to their greatest scope of practice, like being able to really use their skills and their knowledge and their understanding and like use that to the your full advantage, and it's like, we need to be able to work at the top of our scope.
Right.
And like,
because instead we are trying to, pick up all of the slack and we are, changing trash can, like taking out the trash and like doing the beds and laundry and getting labs and like a lot of skill bases, which is like, it needs to get done. But at the same time, like, I think I would rather be doing patient education and critically thinking and talking to the team, and like that's more satisfying to me. But like instead we have all of these other jobs that we have to do because it falls on the nurse.
Right. We hold a lot, like we wear a lot of hats, as you can say, and like the job needs to get done. Unfortunately, with short staffing everywhere, it just ends up falling on us. And you're right, like sometimes we do have to get our rooms situated. Like we're dietary, we're the hucks at the front desk, we are techs, we are everything. And we're able to do those things. Absolutely. But it really makes you appreciate when you do have those people, how much more time you're able to look through your notes in the chart, be able to kind of look through your orders, make sure everything's getting done properly. I mean, if your time is filled doing other things, you just don't have that time to like look through all of those. And I even get to work 30 minutes early usually to look through my notes and try to get a better understanding because I know during the daytime, I don't have necessarily that time to be able to sit down and really look into things.